Well, we are going to go ahead and get started. I want to be respectful of everybody's time and those of you who are here. We really appreciate you being here today this morning. So we're going to go ahead and get started. For those of you who registered for the 11:15 Medicaid waiver meeting, you are in the right place. So I know there's a lot of virtual meetings happening, and if you're kind of wondering, am I in the right place? You are in the right place. So if you're here to learn about the future of the Oregon Health Plan, thank you for joining us. My name is Ruby Graven, and I'm one of the regional outreach coordinators with the OHA Community Partner Outreach Program, also known as CPOP. Good morning, Patricia. I see you. So for those of you who are not aware of the OHA Community Partner Outreach Program, we've been around for over a decade. And essentially what our program does is we partner with community partners across the state, like schools, nonprofits, faith-based organizations, and hospitals and clinics, you name it. And essentially what we do is we train and certify community partners to walk families and individuals through the Oregon Health Plan application and to assist people with navigating their health coverage. So we've been out in the community for over a decade, meeting with our community partners, getting to know them, and really hearing stories of how people are impacted by having health coverage or not having health coverage. And many of us as regional outreach coordinators have actually worked in the community with our community members and OHP members. I actually am a former OHP assister myself. So I spent, over 2 years walking families, more Spanish-speaking families than anything, through the Oregon Health Plan application, probably assisted with, hundreds of applications. And so through this work, we know that our community partners are very critical. And you really are front and center of this work, some of the most important people. You hear the stories from the families, the challenges that they're experiencing, whether it's not knowing where to find an urgent care center or, things that we would think are simple for some of us, like how to take a child's temperature to determine if they need to go to urgent care, what to do with their insurance ID card and what to say when they schedule an appointment. So we're very thankful for all the work as our community partners that you've done over the years to do this outreach. When our program started, we had like 2 people sort of running the show at the state level. And this program has grown from having just a handful of community partners to having something like over 1,500 certified community partners across the state. So we just want to welcome you today, and I want to thank you for being here and say thank you to Yesenia for co-presenting with me and assisting with facilitating some of these slides. So I will turn it over to Yesenia so she can introduce herself.
Hi there. Good morning, everyone. Happy Monday. Thank you for being here. My name is Yesenia Melchor Baltazar. I'm also a regional outreach coordinator out in the South region. And just like Ruby, I was an OHP assister a few years ago, and it's an honor to serve our community. So thank you so much for being here and joining us today.
Thank you, Yesenia. We also have Lori Coiner joining us today to answer questions. Lori, do you want to introduce yourself to the group?
Sure. Good morning, everyone. I'm Lori Coiner, and I am the Senior Medicaid Policy Advisor for the state. I used to be the Medicaid Director, and I've spent the last about 1.5 years working on this waiver. So I'm really excited that we have so many people who are interested, and I want to thank all of you who joined our community partner meetings when we were planning the waiver, because there are some things that we learned from the community partners and members around areas where the Oregon Health Plan wasn't working for them, and that we were able to put that in our waiver in some cases. And so I want to express that this is a waiver that comes from input from all sorts of people, and we really appreciate those of you who have been engaged in the process throughout. So thank you very much. And I'm around to, you're in great hands with Ruby and Yesenia. And so I'm just around to answer questions.
Thank you, Lori. Okay, so before we get started, we do want to just kind of pick your brain and ask a few questions. So I'm going to go ahead and launch a poll here in just a moment. It looks like we still have people joining us a little late. So I just want to make note, Yesenia, that we do have about 138 people who have joined us today. And we have over 200, and I think it was like 230 was the last registration list that I noticed.
Yeah,
So
and we also have a few folks who are having a hard time joining, so yeah.
Okay, so you know what I'm gonna actually do before I launch this poll is just talk to the group about the Medicaid waiver so we can get more robust input from you all. I wanna make sure that as many of us as possible can participate in the poll. So why don't we just go ahead and advance our slides, and then just remind me here in just a moment when we have more people logged in to launch that poll, and we'll hear from you directly. Okay, so for those of you who are new to this work and haven't heard of the Medicaid waiver, we're going to talk about that here in just a moment. If I could get a show of hands of how many of you are familiar with Oregon's Medicaid waiver? Or when you hear 1115 waiver, how many of you feel like, okay, I know what you're talking about, and you don't have to consider yourself an expert, but if you're sort of familiar with what we're talking about, just give yourself a little, just raise your hand. Thank you. So if you're still learning about Oregon's Medicaid waiver, that is completely understandable. I have to tell you that a lot of our community partners, and along with OHA staff and ODHS staff, so those are people who work at the Oregon Health Authority, Oregon Department of Human Services, are still learning about Oregon's Medicaid waiver. So if you're feeling like, why don't I know about this? There's just so much to learn in our world when it comes to eligibility and the Oregon Health Plan, right? There's 68 different scenarios for assisting people in getting enrolled in the Oregon Health Plan. So don't feel bad if you don't know what it means. We're all still learning together. So for those of you who are new to this term, and if you haven't heard of the 1115 waiver, what is it? Right? People are eligible for the Oregon Health Plan based on their income and for other reasons. And there are federal rules or standards related to eligibility and required benefits. But Oregon can ask to waive some of those federal rules to have more flexibility and to offer the Oregon Health Plan to more people and cover more services than is usually allowed. So essentially what the waiver does is it allows us to sort of customize our health plan, our Medicaid program, excuse me, to the needs and preferences of our communities. Now we have this opportunity every 5 years, which is why this meeting is so exciting. So every 5 years, Oregon must renew its agreement with the federal government around the Oregon Health Plan. So what we did is we got your feedback, as Lori mentioned earlier, over the last year and a half, and actually longer, because we've collected a lot of input from community partners across the state through, CCO 2.0, through the State Health Improvement Program plan. And there's just been so many different places where community members have been talking for years and years about what needs to change. And so we've collected that input. And at this point, we're here to announce some of those, what those approvals look like. So the federal government can accept or reject these proposals. And today we'll be talking about what has been accepted, which is why we're so excited to talk about that. All right, next slide. So for today, we'll be talking about our Medicaid waiver through year 2027. So a lot of people have been very excited and like, when do we get started? Some of the changes are happening sooner than later, but really there's changes happening in the end of 2023 and 2024. So this is going to take some time. So we may not have a ton of details, really granular details in terms of implementation today. So those conversations will come later. But what we can tell you is that the primary goal of the waiver has continuously been to advance health equity. And, you know, when we talk about advancing health equity, those sub goals are really making sure that people in your community can maintain their health coverage. Other sub goals include improving health outcomes by addressing social needs that impact health. So social needs, for example, like housing and food benefits. Ensuring smart, flexible spending for health equity. So, you know, there's times where we do things that, while we have good intentions, don't really make the impact we're looking for. And so we're really moving in the direction of meeting people where they're at and making sure that we are actually really investing in community and being smart about funds. Creating a more equitable, culturally and linguistically responsive healthcare system. So remember, if we're going to advance this work in health equity, we know that we need to look at making sure that the care people are getting, that people get, is culturally appropriate and linguistically appropriate. So that might mean, you know, making sure that information is available in, you know, specific language, and instead of just having it be available in writing, maybe it's a verbal presentation or a video, or it's an in-person meeting with an individual or a family. So when we talk about having a linguistically responsive healthcare system, it doesn't just mean to translate documents in writing for people, because there might be people who do better with having that in-person conversation or through storytelling. So just want to give you a few examples of what we're talking about when we say things like, we're going to advance health equity, which has become such a buzzword, right? Those are buzzwords these days. So I want to be sure that I'm painting the picture for you all. Thank you, Sonia. You can advance the slide.
Yeah, I was just gonna ask you really quick, are we still gonna do the poll, or do you wanna wait until the end?
If you've noticed that we're not getting a lot of new attendees, I can go ahead and launch that.
Yeah, I think we're good now. Yes, I think,
Okay.
yeah,
Thank
it
you.
will be a good time. Yeah, of course.
All right, so I'm going to go ahead and launch a poll. We had a few people that were logging in a little later, and I wanted for most of you to have an opportunity to participate. So I'm going to go ahead and relaunch the poll. So if you could just pay attention to your screen, this should pop up here in just a moment. Okay, so if I could just, yep, it looks like there it is. I was gonna test and ask if you could see the poll, but it looks like people are answering questions. Is everyone able to see the poll results so far, or is it just me that can see them? Maybe I can ask Patricia, since she's one of my community partners, and I know she's on this call today.
Oh, Ruby, you always put me on the spot. Yes, we can see your poll. Thank you.
Okay. Perfect. So you can see the results too as people are answering questions?
Yes.
Okay, fantastic. Thank you so much, Patricia. I knew you'd let me just call on you right on the spot.
Anytime, Ruby.
So the questions are, how do we meaningfully engage community partners? This is specific to this work. So as we start to talk about the Oregon Health Plan, what the future of the Oregon Health Plan is going to look like, and we really focus on implementation. So we start to dive deeper into, you know, standing up the work and making sure we're not harming our communities, and making sure we're doing what we want to do. So making sure that impact is really happening across the state. What are some ways we can keep you involved to inform the process? Is it best for you to participate in virtual meetings? Do you feel like you could participate more if the meetings were in person and offered across the state? And if you're an OHP member, or if you know OHP members, how do you, like, tell us a little bit more about what would work most for them? What would be most effective? Would those be virtual meetings? Or perhaps you have OHP members who, you know, really value that in-person interaction, don't have access to the internet, don't have someone to walk them through the technology. So there's always going to be different reasons. And so we want to know what's the best way to engage OHP members so that they can inform the implementation of the Medicaid waiver. And if you have other ideas, anything creative that you can think of, just make sure you put that in section 3, the short answer. So it looks like 76% of you have participated so far. Some of you are still thinking. Maybe a few of you went to go grab a cup of coffee. So if that's the case, run back to your computer and make sure you participate in the poll.
And Ruby, I just want to mention that we do have a few comments in the chat box, and unfortunately a few of them cannot see the poll. So maybe we can put the questions in the chat box.
So when people can't see the poll, do you mean the results? Yeah, it looks like people aren't seeing the results. That's what's happening, Yesenia. So it's, okay. I would have to share my screen. Do you want me to do that? In order for people to see the results, I can go ahead and share.
You shouldn't need to share your screen. There should be a way to just publish them so that they're visible.
Okay, so I'm going to make sure that I click the right button. And then you all can let me know if you can see the results. We're just going to give it another minute in case other people are still thinking through their responses. Okay, so I think this is about as much participation as we are going to get. So we have 114 people out of 138 that participated. So 83%. So I'm going to go ahead and share the results. If you didn't get a chance to put your response in the poll, you can add it to the chat. So you should be able to see the results. Yesenia or anybody who wants to unmute themselves. If you're not able to see the results, let me know. And so it looks like 72% of you would appreciate virtual meetings, whereas 62% of you would prefer in-person meetings across the state for community engagement specific to the waiver implementation. That's pretty close right there. How do we meaningfully engage OHP members? So if we're talking about really centering this in health equity and making sure our members have a voice, it looks like most of you are saying in-person meetings across the state would work a lot. And then, you know, virtual meetings, so maybe a hybrid situation. I know there might be people who have transportation issues, or it's just way more convenient for them to participate in virtual platforms. So it totally makes sense to have, you know, there is a combination here. And then it looks like there are other ideas that have been shared, and I am not able to see those other ideas right now. I will probably have to log into the back end of Zoom and pull those, but I'm happy to share those with the group as a follow-up if that's something you all are interested in. All right, so we're going to go ahead and move on. Thank you, Pat, for putting that in the chat. All right, some very exciting news for all of our community partners who, you know, every year, I know you love seeing your families and individuals to re-enroll them in the Oregon Health Plan. But with Oregon's new Medicaid waiver approval, kids will be able to stay enrolled until their 6th birthday. So this is, if there's income fluctuations, we don't need to worry about that anymore. Regardless of income fluctuations or other changes that would normally affect eligibility, kids will stay enrolled until their 6th birthday. And then people ages 6 and over automatically stay enrolled for 2 years. So instead of 1. I just want to be sure, like for those of you who, talk about renewals or redeterminations, so this is really something we're getting away from, really to ensure that there's seamless coverage and that people aren't experiencing this churn or this constant having to go and fill out that big packet. So this is really good news because right now our OHP application is, I don't know, what is it, 22 pages long? I lost track. We've changed it a few times, so it's really good news. We don't have all the details of what this will look like quite yet, but just know that this is going to be new and we're really excited to be able to share this with families. All right, next slide, Yesenia. I think, one thing to point out for people who aren't enrolled in the Oregon Health Plan and have never been enrolled, their experience will be very different than families who've historically been enrolled in the Oregon Health Plan, because what they're going to experience is just having that seamless coverage, staying covered longer, not having to re-enroll as often, and just not having to deal with all that back and forth. So this is really good news for people that are coming on board. They'll have a much more positive experience. Next slide, please. So there's been a lot of excitement around what's changing, or specifically around social needs. So when we talk about the social determinants of health, every single month we're talking about social determinant of health related services in our community partner collaborative meetings. So for those of you who are not aware, every month we have community partner collaborative meetings with our OHP assisters across the state. It's something over, 18 meetings across the state. Some of them are in person, others are virtual. And in those meetings, we've really shifted from just focusing on talking about the Oregon Health Plan and getting enrolled. And we've really moved our mindset to think about the social determinants of health. So we talk about how to connect people with social needs like housing and food benefits. We partner with other state agencies like the Oregon Housing Community Services, the Oregon Employment Department, and ODHS. And we bring resources to these community meetings, these community partner meetings, to make sure our OHP assisters can talk about these services in their appointments as they're walking people through the OHP application. And so really they're experiencing that wraparound approach. It's not just, oh, all I can help you with is this OHP application. Because those of us who have, sat with families and individuals and walked them through the OHP application, we know that there's a lot of trust built in that appointment. And many times people want things like a library card, assistance signing up for an email address, assistance finding a phone, internet, all these things that really contribute to someone's health and well-being. And so for that reason, we want to make sure we continue to talk about this shift and really focusing on the social determinants of health and social needs and how things will be changing. So youth with special health care needs, ages 19 through 26, will be able to retain more robust benefits. And these are CHIP level benefits. So for those of you who don't know what that means, it's child health insurance program. Is that right? Did I just had a complete poof, Yesenia? I think that's right, yes. So youth with special health care needs are youth For example, these would be youth who have serious chronic conditions as represented by the pediatric medical complexity algorithms list. I know that sounds really complicated, but those of you who work with youth with special healthcare needs to be more familiar. These would be youth who have serious emotional disturbance or serious mental illness, or people who have been diagnosed with a disability through the Office of Developmental Disability Services, and any youth who have an elevated service need or functional limitations as determined by 2 or more yes responses to a screener asking questions. So those are a lot of details. And we just wanted to touch on those because we knew that some of you might be curious about those details. We will continue to have these conversations throughout the year. So if you feel like you have more questions, there's, yes, child health insurance program, thank you. That's what I thought, but for a second there, I was second guessing myself with all these different acronyms. So back to where I was, just remember that there's going to be multiple conversations throughout the years. So if we're not answering everything today, or if we're not diving deep, it's because we're going to continue to have discussions with you. So other things that are changing, so providing the benefits of social needs for youth who are welfare involved, including leaving foster care at age 18. People who are experiencing homelessness or at risk of homelessness, older adults who have Medicaid and Medicare health insurance, and people who are released from custody, people at risk of extreme weather events due to climate change. So these benefits are called health-related social needs in the waiver, and benefits will begin in 2024. So we have some time, right? Which is why I had mentioned implementation and how to engage our community partners and OHP members as we start to build this. We're making sure we're building it with you. Thank you. Next slide. So what this means for OHP members, under the new waiver, OHP members will get increased care and social supports in more situations. So these are some of the situations. And we know this doesn't cover everybody that we want to be mindful of. This is a start. And so we don't know what the future holds. Maybe the future, down the road waivers will be even more robust. But for now, some of these situations include people who are leaving the Oregon State Hospital, other psychiatric residential facilities like jails and juvenile corrections or prison. People who experience extreme weather events will have supports. So this could be like a wildfire, for example, which Oregon has been dealing with these last number of years. And that's truly impacted some communities across our state. This is really exciting news. Youth in foster care who are transitioning out of foster care. Youth with special healthcare needs will get those social supports, as well as increased vision and dental services, which we touched on earlier. And housing supports for people who are experiencing homelessness. So just to talk a little bit about housing, we can dive a little bit into that. Next slide, please. So when we're talking about housing, we're specifically talking about, here's just some examples, rent assistance payments, temporary housing for 6 months, such as, getting people going by providing a rental deposit. We know that's a huge barrier. Or maybe it's looking at working with people who need assistance with their application fee. We know that a lot of our community members have a hard time finding housing, and many times they have to pay multiple application fees, and sometimes they get denied multiple times. So these are just some examples of some things we could look at. Utility assistance for up to 6 months. That's huge. That's really big because, we have such extreme weather situations happening in Oregon with the heat. And then when the weather gets really cold, There's been people who want an air conditioner, but maybe don't set it up because they're worried about their utility assistance bills. That's very common. And, we know a lot of families live in apartments, sometimes second level apartments that get hotter. So the fact that utility assistance for up to 6 months could potentially be an option is huge. Home modifications such as ramps or handrails, that's something that we could financially support. So perhaps you're working with a community member who says, hey, I've slipped in the shower a few times and I could really use, some sort of non-slip bottom on my shower tub, or have a bar in there. And then, maybe you call the landlord and say, hey, can we make an accommodation request for this person? Sure, we can approve this. However, this person needs to pay for it. And where do they come up with that money, right? So these are just examples of things we could potentially support, or we will be looking at supporting. Pre-tenancy and tenancy support services, we've kind of already touched on that, but maybe things like moving. That this will come together as we get closer with your feedback, but we know partners have talked about, how do we move people's furniture from one place to the next, or how do we get them set up with furniture so they can live in their apartment for the first time. And some communities have really great support services, but other counties don't have the same support. So this is something that we're going to be looking at. Housing focused navigation and or case managers. So these are advocates in the community who really walk people through advocacy. So for example, I work with this wonderful person at Kaiser, and she literally helps people get into housing that have been denied multiple times. She's amazing. She's telling me she's somehow gotten 200 denials approved in her work over the years. And maybe people are experiencing discrimination or these different issues where they need to be pointed to legal support. So this is something that a housing focused case manager or navigator could do. Just some examples. All right, next slide, please. Oh my goodness, can we just talk about food for a second? Just like the one thing that brings us all together. It's like music, right? Food is like music. It's like when we have food, when we can offer fruits and vegetables, and it's just something that brings us together, right? It's been a big thing we've heard about over the years. I still remember doing a home visit with a family and sitting down at the kitchen table and walking through the OHP application with mom and looking through her cabinets, and she's showing me what she has for the month to eat and what she's missing. And she says, I can get fruit in this house, maybe if I'm lucky once a week, and it's gone the same day. It's so expensive. It's not affordable. And, when we're talking about things like, decreasing diabetes or reducing someone's blood pressure, having access to fruits and vegetables and nutritional food is so critical, and people want that. They want it more than anything. It just has not always, it's not accessible. So what's really exciting is to think about the fact that with Oregon's new Medicaid waiver, we will have these community-based food resources, such as application support for SNAP and WIC, and nutrition and cooking education classes, and these fruit and vegetable prescriptions. I love the cooking education classes. I remember we facilitated some of those classes when I was at the Hillsborough Family Resource Center, and people would come and learn and cook a meal and connect with each other, and then they'd take a recipe home and take leftovers. It was a lot of fun and a great way to create that connection. Or perhaps medically tailored meal delivery. So, this could be, for example, if you have a patient at your clinic. I know I've had some of my clinics reach out and say, hey, Ruby, I have people going through cancer treatment. They're experiencing issues with their digestive system and they need to have specific foods. So something that is going to change is being able to offer these meal tailored delivery programs to people who need it for medical reasons, so stomach issues from radiation or meals to help control diabetes. Next slide, please. I think this is you, right, Yesenia?
Yes, it is me. So thank you so much for being here with us. Now we're gonna talk about a little bit about the updates about protection from climate or weather events. These supports may include one or more of the following components: payments for devices that maintain healthy temperatures and clean air, including air conditioners, heaters, or air filters, and also generators to operate medical devices like ventilators when power outages happen. So what this means for OHP members is that right now, limited supports for housing, food, and climate are provided by CCOs to their CCO members only through flexible services under a program called health-related services. But under the new waiver, these social supports will be covered benefits through the Oregon Health Plan. And that means that everyone who qualifies for that benefit is entitled to receive it. OHP members who are facing certain life changes will have social supports available to them to stay healthy at times in their lives when they're experiencing a greater need. Now, we will quickly touch on our plan engagements to talk about the waiver with CMS the upcoming month. Some concepts within the waiver were not able to be approved at the end of September, but for the Center for Medicare and Medicaid Services, would like to continue to work with Oregon on these concepts. And these concepts include community investment collaboratives to fund local health equity efforts, tribal priorities, justice in both populations, included clients who are in the state hospital, which means OHP coverage before people leave custody. And this is because having OHP coverage before people leave custody will make it easier for people to have access to their medications, find a provider, and therefore be more stable in their communities. All right, so some of you already answered this question earlier, but I know we have still a few folks join us the meeting a little later. So we would like to hear from you. And if you can please put your answer in the chat box if you haven't been able to answer this question. The question is, how do we meaningfully engage OHP members and community partners like yourself in 2023? And for those who already answered the question, we would like to have a discussion with you about it. If you would like to unmute yourself or put your thoughts in the chat box, this is your space. And I got a little behind in the chat box, so whoa.
I'm in there right now.
Okay, thank you. I closed it for a little bit, and we have a lot of comments.
So Bella is asking if there's any idea yet on how members will access benefits. Can you, Bella, will you clarify which specific benefits, or maybe Lori, you know what? Maybe you're
Yeah, I can start. So one of the pieces, I guess, to make clear is we received authority from the federal government to start providing these services on September 30th. But we need a lot of time to figure out, in many ways, answers to all of your questions, like how the services are going to be provided, setting up networks in areas that we've never worked before. And so the agreement that we made with the federal government is the services will start on January 1st, 2024. At least some of them will. And that gives us a little bit more than a year to work with coordinated care organizations, because they will be the way that you access services. So just like if your child needs a tooth cleaning And that service is paid for by your CCO. It's the same. If you need the food services or you're homeless and you need housing, then a person would work through their CCO. So more to come on that. And these are, now we're starting to think about how to do all this work. And this is where I think that we can get lots of valuable information from folks like you who either are members or work with members every day in how we make these services available in the easiest way possible for our members. So hopefully that's helpful. And I don't know, Ruby or Yesenia, if you're on mute, but.
Thank you, Lori. I was on mute and my button finally worked. Okay, so did we answer the question from Kim? I'm confused about the benefits for people leaving custody. You mentioned that in 2024, people being released from custody would get OHP. Then you said that OHP coverage for people leaving custody is not covered. Can you clarify?
Sure. So it's a little bit of a complicated answer. So the services, so people who are leaving custody, whether it's youth or adults, will have OHP coverage when they leave. That's always been the case. I know that there's a lag for a lot of people and we are working internally to fix that. But once they leave, they will qualify for the housing and nutrition services. One of the things that we also asked for on the waiver, though, was that people who are in custody could have a partial benefit before they leave, so they could start to meet with, if people are in custody and, for example, not members, they could meet with application assisters, or they could meet with their CCO care coordinators to help them get appointments set up and get their housing set up. We did not get approval yet for that part from the federal government. And we're continuing conversation. I believe we'll be talking to them here in the next couple of weeks on it again. So more to come. I'm fingers crossed that we get that authority as well, but it didn't happen by September 30th yet. So hopefully that clears up some of the confusion.
Thank you, Lori. Paula just says she's surprised. So Paula just is surprised that it'll take so long, even though we're approved in 2022. Is that related to like the Medicaid waiver being like 5-year thing? Every 5 years?
The Medicaid waiver is 5 years, and the reason is that we need to figure out lots of details. So, for example, housing providers, the providers who will be helping folks get housing, they have not typically worked in Medicaid. So we have to work with them on how they'll do billing and how they can get reimbursed for their services from the CCOs. And then we have to figure out pricing. So how much do they get paid for helping? And that just takes a lot of time. And then we need to make sure within the agency, within OHA, that we have staff who can provide oversight, because these new services will be benefits. And so if a member doesn't get them, they can appeal. So we just need to make sure that we have the proper staffing and things in place to make sure that the CCOs are ready to do the work. Because what we don't want to do is start this program and then not deliver the services that people are entitled to. So I know it takes a long time, and I know that's frustrating. It's just a huge change. There's no state in the country that's ever offered housing and nutrition services as a benefit for members. So we're the first in the country. And so we're all going to be learning how to do this because it's new. So,
Lori, I know housing is a hot topic in this meeting. I can just tell from the chat. And in April of 2022, we asked community partners across the state where were they, like we wanted to know which areas we could provide more support, and housing was number one, along with two other items. One was like assistance with social security disability, and I can't remember the third. So with housing being such a hot topic, I mean, right now what we do is we ask people to work with their community action to offer rent assistance, or reach out to Oregon Housing Community Services if there's any barriers to accessing that rent assistance. In addition, connect with your CCO to see if they have any health-related services funds available to assist with rent assistance. But we know that the health-related services, it just varies by county and by CCO, and there isn't always funds available to assist with rent help. And I mean, what can you tell us about health-related services right now? Is there anything else you can expand on?
Yeah, so I want to make it clear that when we talk to the federal government about this, there was concern. What they weren't willing to do was provide money to Medicaid programs or to, like, the Oregon Health Plan for housing, and where we would stop other services. Right? They will only agree to do this if we agreed to keep the other services going. So just like you mentioned, Ruby, community actions, connecting with Oregon Housing and Community Resources, those things will still be available. And in fact, the Oregon Housing and Community Services Division, we're working closely with them so that when Medicaid helps a person with temporary housing, that then we can work to try to get them permanent housing. So that health-related services with CCOs will continue. This just provides more, what do I want to say, even more, the service will be similar across the state, where, like you were saying, health-related services is kind of CCO dependent or county dependent. That will still happen, but for these specific housing and nutrition services, they'll be more consistent across, the availability will be more consistent across the state. I want to emphasize that the housing services aren't available for all OHP members, so they will be members who are in those transition groups, like people leaving criminal justice or kids, in the foster care system, but also for folks who are homeless. So it's not available to everyone, but for people who are in these life transitions where we know they really struggle in particular with housing and nutrition. And yes, these services, I see there's a question. There are a couple other questions. So immigration status, we're still working on whether this is going to be, these services will be available to folks who are on Healthier Oregon. So more to come on that. That just depends on funding. So we'd like to make it available for, and same for kids on Cover All Kids. So we're hoping that this will be seamless, just like our enrollment is. And I believe that's how it's going to work, but we're going to have to secure general funds for it. The other thing, for folks on Open Card and the Indian Health Service, these services will be available as well. So not just CCOs. Okay, I'll turn it back over to you, Ruby.
Yeah, I've just noticed some comments about how we involve community partners and OHP members in the implementation of the waiver. And there's a lot of, it seems like kind of a theme of like, there's no one size fits all approach, and maybe offering various options is the way to go, and sort of meeting people where they're at. Kimberly followed up and said, for Open Card and Indian Health Services, did you expand on Indian Health Services, people on Open Card that are tribal members?
Hi, this is Tabitha Jensen. I'm actually using Kim's login. I was just curious if that is expanded outside of CCOs, who I know usually the CCOs have pretty robust models for doing that service delivery with care coordination. So I was just curious for those folks that fall in those other gaps. Usually that's the challenge, even with like wrap services for young people, where there just isn't anyone to do it. So how is that going to work?
Yeah, still sorting that out. So there is a lot of energy within the agency around, well, making sure that we will provide this for folks on open card, including travel members. I'm not sure how that's going to roll out yet. The Medicaid team's looking at that to see, whether there's some kind of contracting service. So that's partly why we need the year to make sure that when we roll out on January 1st, 2024, that the same services are available to all members, whether they're in a CCO or on open card. So really good questions. And I do want to, I'm really excited that there are so many questions, because I know that means people care about this. So keep on asking. And I'll also, and I don't know, Ruby, how you want to do this, but I would love to hear, and I know Dana Hiddle, our interim Medicaid director, we'd love to hear, ideas about how to connect with community partners in implementation. And so I don't know that we can solve that today, but would love to have opportunities to learn more about that. And if we can't get to it today.
Yeah, so we ran the poll and there were a few people who had other ideas. It sounded like overall people were saying virtual and in person, and making sure everybody across the state had access to those options. So meeting virtually, in person. Usually when we do in-person meetings, we work around, a model of offering evening opportunities and excuse me, some of the input we've heard from community partners is like making sure there's childcare involved and meals for parents and children. Sorry, I'm losing my voice here. But there were other ideas that I'm not able to see until I log off of Zoom. And so we wanted to offer this as an opportunity for people to share their ideas. And there's mostly been questions. So I think people are still thinking about what their ideas are for waiver implementation engagement. And if that's the case, that's okay. You can email our waiver team and I will be sure to get that into the chat box for you all. Nayeli. Buenos días, Nayeli.
Buenos días, Ruby. Hi.
Hi.
Yeah, I was thinking for engaged OHP members, it will work better in person. And also I was thinking, because even for us, like we have a good relationship with the Hispanic or Latino community in our area, but it still be challenging when we offer any, we do any outreach event, even if we offer dinner and childcare, it still be challenging. And I'm a former cannery worker, I will think like, how that's even if we offer all this, we can think, oh, but we are offering all this, right? And we are even doing like 7 p.m. We offer this presentations or these events at after hours, like 7 p.m. and how they didn't come. But as a former cannery worker, I can think like working on those places is really tiring, and the least you want to go is after being off work at 6 p.m. going to one of these meetings. So I was thinking like probably if we go to those workplaces, and we also tried that, but I'm thinking like coming that from a bigger organization or OHA, because like Consejo Hispano is a small organization, or any nonprofit community organization that comes to them, they said, oh yeah, you can do this presentation on their break time or their lunch time. And they have 30 minutes for lunch, and they have big line to warm their lunch. So they have only those 30 minutes, and sometimes they are working 12 hours. So obviously they want to use that time to eat instead of hearing or giving us feedback. So I was thinking probably if you can, when you make those presentations, somehow we can make a deal with the employee and pay like 20 minutes to them, or even if it's possible that reimburse that money, even if to the organization or the workplace, for they give that space in order I'm sorry, I get nervous now and then the words didn't come in English, but yeah, I'm just thinking like if it's some way that the worker said, oh yeah, you have this 20 minutes or this 10 minutes or 30 minutes, and you can share that information with them or hear from them, and having that space. Thank you.
Thank you, Nayeli. Other ideas or questions? Sounds like there's some agreement there for you, Nayeli. This is pretty much a trend as we hear, is like we're getting feedback from people, we're asking them for their time, making sure we're offering some sort of incentive for people's time, to be respectful of their time. Any other ideas or questions you've thought of? I've also included our email. If you have anything you want to add after today's meeting, or if you just want to think it over for the week. So don't hesitate to send us ideas or any questions. Any last minute questions? Social media, that's a great idea. So leveraging, is it possible to connect with the sisters and navigators at various locations in the community? So Cass, do you mean just kind of leveraging our current OHP assisters to have these conversations with members? That makes complete sense. I think that's what you're saying. So if I'm at an outreach event or I'm doing street outreach, maybe there's like a sheet of paper where someone can write their story and say what they need, what their idea is, or how they would like to see the future of OHP look like, because that's probably what you're talking about. Is that right?
Well, for the most part, but like a lot of people, a lot of agencies are doing this. They establish presence at local places throughout the community, particularly places where homeless and those at risk of homeless will frequent. And so I'm just thinking if you could connect with some of the sisters and outreach workers who are at these locations with your flyers, or even with staff who can, kind of promote what you're offering.
Yeah, that makes complete sense, because that the community partners are the people that OHP members trust and have those relationships with.
So I was just
Absolutely
specialist there, and I took a different position with Southeast
oops.
Works. I worked
Harry,
downtown at the EAC Center.
There we go. We needed that person. All right. Any questions or other ideas? Will office be open for in-person conversations? Tech is great, but not if you don't have access to computers, Zoom, electricity, or videos in the office while they wait. Oh, videos in the office while they wait. Okay, so Michael, will you expand on that more? Would that be, when you say office, do you mean like a ODHS office or a work source office? And maybe the possibility of having a video going while people are waiting?
I'm sorry, I don't actually know how that got pasted in the chat. I'm looking over my own question apparently.
Oh, maybe was it about something separate? Will office be open for in-person conversations? Is what it says in the Zoom chat.
Oh, you know what? I'm sorry. Someone else is also logged in as me.
Oh.
So maybe that's Dee Dee.
Michael number 2. Yes, in work source offices, yes, maybe even on survey. So I think Stevie or your colleague, whoever is logged into you today, is referring to work source offices. These are your ideas and they're great. There are no bad ideas. This is exactly what we're asking for, is like, let's get the creative juices flowing. If like, what is your vision for meaningful way to get input as we build the future of OHP? It's really up to you to decide, what you think would work best for your community. Oh, DD. Okay, I thought you said Stevie. Sorry about that. Thank you, Sean. It's good to see you. Michael, I'm just laughing because of the mix-up. I can see that happening to me. Good. That's a good Monday laugh. Well, thank you, everyone. Really appreciate everybody joining this meeting today. We are going to be following up with you. There will be more conversations around what we heard from you, what questions came up, and stay tuned for future meetings where we can talk about how this implementation might look. Don't hesitate to email us. So there is an email address here at the bottom, the 1115waiver.renewal email address. We're looking forward to hearing from you. So if you think of anything else this week or next week, don't hesitate to reach out. And I'm going to go ahead and hang tight here with Yesenia and Lori for like the next 5 minutes to see if we have any other questions that trickle in. And if you need us to stay longer, we're scheduled until 11 a.m. So there's time.
So
There's actually a hand raised. Okay, go ahead. There you go.
Yeah, I did have a question. There was a couple of questions in the chat about whether or not we would receive these slides.
Yes, we will make sure we have a list of everyone that's registered today and everyone that's participating. So as long as you registered under your name, you will get the slides. If you didn't register and you're under Michael's login or somebody else's login, you will want to put in your email address in the chat box so we can send the slides to you. And I can also post them on group site. So yeah, we'll definitely be posting these slides in various places for you, and the YouTube recording. So we're gonna convert this meeting into a YouTube recording if you want to share it with your team members or your supervisors, or if somebody couldn't be here today. So it will be available. And we should have it available within the next week or so, if not sooner. Thank you, Cass, for that question.
Thank you.